Hey guys and fellow bros, welcome to Man Up Malaysia. It's a channel, it's a place where we can get together and talk about men's health issues, all right? Something that we don't really talk much about. I understand, I'm a guy as well, we don't like to talk about this, but we hope a conversation online could help create more awareness and also help you if you're having any men's health issues. Now, if you're new to this channel, that's great because we're new as well. So what we're going to do in this channel is have a lot of interviews with doctors, health professionals, and also people or sources that we can get to get more information that we think will be beneficial for you. So if you think this is a channel that you would like to subscribe, please do subscribe to our channel. We really appreciate that. All right. So in this episode, we'll be talking about erectile dysfunction treatment options. So what will you learn in this video? Well, first of all, we want you to know why it is so important to treat erectile dysfunction early. Also, can watching too much porn cause erectile dysfunction? How do pills, injection, have you heard of shock wave therapy? How can that help men with ED? And also, that's the latest fix for ED. It comes in the form of a gel. It's called Med 3000. Well, does this actually work? We'll get our guest to tell us more about it. And if you're Malaysian, you're probably familiar with names like Tonka Ali and Urut Batin. Does this actually help men with ED? And finally, we're going to end our video or our topic for today with a discussion or to let you know about the latest men's health platform in Malaysia. It's called ensuns.com.my. My guest today is a medical advisor on this platform, so we'll like to know more about it and how Ensuns can help men in the area of men's health in Malaysia. All right, so stay tuned. Lots to cover in this episode, and I hope you will enjoy the conversation in this podcast. Now, my guest is a senior consultant urologist at the Faculty of Medicine at UKM. He is Professor Dato Dr. Zulkifli Md Zainuddin. Hello, Prof. How are you?
Hi, Kevin. I'm fine. Thank you very much for inviting me. So really a pleasure.
Maybe you just want to tell us a bit about the work you do as a urologist.
Okay. Yeah, as you know, I'm a urologist. I've been working all this while in Hospital University Kebangsaan Malaysia, or they call it Hospital Chancellor Tuanku Mekris in Cheras. We are part of, I'm part of the medical faculty staff. And I've been a urologist since 2005. And my interest is actually men's health. So I deal a lot with men's health issue. As you know, erectile dysfunction, premature ejaculation, testosterone deficiency syndrome, men's voiding dysfunction, for example, like prostate problem, overactive bladder. So those are actually my interest and my passion, actually, Gavin.
Yeah. All right. So before we talk about all the treatment options for ED, I always want to highlight why men should man up and treat ED early. And here's why. ED can be an underlying cause for a serious medical condition and can lead to other problems, be it medically or emotionally related. So, Prof, can you talk a bit about why it is important to deal with ED as early as when one suspects he's experiencing some sort of erectile dysfunction?
Okay. As you know, Kevin, ED is associated with so many problems that you mentioned just now. For example, namely diabetic, hypertension, obesity, and then of course the psychogenic part of it, depression, anxiety, relationship issue. But the more important thing that I want to highlight is that now ED is really closely related to cardiovascular disease. So did you know that in studies that have been done, when a man presented with ED, for the next 3 years, he have a very high risk to develop a heart disease or cardiovascular disease. So meaning that ED now is sort of like early sign for cardiovascular disease. So when men have ED, we also have to take this opportunity then when they presented to us to screen for cardiovascular disease, because they can develop cardiovascular disease as early as 3 years from the onset of erectile dysfunction. So that is the one that is important to catch men early in the disease. So that's why they have to come forward. So when they come early, it's our opportunity to catch them early. rather than, presented with acute myocardial infarct or, angina. So 3 years down the line after the first development of ED. And as you know, sometimes people don't go for medical checkup regularly, right?
Yeah.
So sometimes they don't know they have diabetes, they have high cholesterol, even they don't have even they don't know that they have hypertension. So this thing presented normally they will present with ED. So that's a good thing about it, catching early.
Another point we want to highlight is, especially for men who are just starting to experience erectile dysfunction, it's important to know some of the causes. Erectile dysfunction, some of the causes is poor lifestyle choices, like our diet. As we get older, we exercise less. Maybe, when we are young, we're always playing games and stuff. And then the smoking and alcohol consumption. All this contribute to erectile dysfunction, right?
Yes, definitely. Because as you know, erectile dysfunction is, it is due to two main problems. The first one is the vasculogenic issue, meaning that when you have diabetes, you have hypertension, definitely will contribute to ED because the blood vessel began to narrow down and, began to get clotted. So these are the issue. And of course, second one is neurogenic, where diabetic especially will cause some nerve issue, which also can lead to erectile dysfunction. So, and of course, as you said just now, poor lifestyle, sedimentary lifestyle, these are the contributor to hypertension, diabetic, and obesity, which of course will lead to erectile dysfunction. So, and as you know, the numbers are actually quite scary. Do you know how many men in Malaysia suffer from ED, Gavin?
No idea.
Okay. The latest study by Kementerian Kesihatan and our group from the men's health aging male group, 7 out of 10 Malaysian men suffers from ED. It is about 47%. So it's actually quite high, very high.
Yeah.
Yes.
I mean, I would have guessed 3 or 4 out of 10.
No, the latest figure is 7 out of 10. And it's quite scary because all this associated medical issue. Of course, as you know, there is also a psychogenic ED, but what we are concerned is, of course, the organic ED, which leads to hypertension, diabetic, and obesity, and all the medical problems that we discussed just now.
So remember, don't just brush off ED. If you're starting to have weak erections or no erections at all, you may need to relook your lifestyle, your stress management, or more importantly, any underlying medical condition. Now, if you haven't heard, there's something known as porn-induced erectile dysfunction, PIED. Let's find out if watching too much porn can actually cause ED. I don't know whether this is a cause of ED. I've heard of the pornography-induced erectile dysfunction.
Okay.
Maybe you can talk to me about that.
Right. Okay. Well, pornography-induced erectile dysfunction is actually a term that referred to ED, which is, they said it is related to pornography. It is what we call the psychogenic ED, psychogenic, because it's more towards psychological. The issue is that studies have been done, actually, Kevin, to show that practically there's no such thing as pornography-induced erectile dysfunction. It's actually there is a weak connection between watching pornography and erectile dysfunction. But when we look into this kind of causes of ED, it is mainly because of problem with body image. As you know, when you watch pornography, the actor, the actresses, and all that are really well selected, So when the men having problem with body image, they will sort of like have this erectile dysfunction, psychogenic erectile dysfunction. And the second thing is that they kept comparing their performance with the actor. This is also an issue because nobody can perform that long, frankly speaking. So so all these things will sort of like make men want to perform better body image, and when they can't reach that level, they will have what we call the psychogenic pornographic induced erectile dysfunction. So it's mainly on their mind, actually.
Yeah. So
You
we are,
can see from pornography, right? They go from like bedroom to living room and then going
yeah,
back to the bedroom.
yeah,
So nobody can perform like that, actually, Gavin.
yeah. So
Truly.
we are giving ourselves a false standard of what or how long sex should be, something like that, right?
Yes, the benchmarking is too high.
Too high.
And then when they can't perform, they can't meet the standard of pornography.
Mm,
So they will have this kind of problem. And of course, it will definitely lead to erectile dysfunction.
yeah. But what about the aspect of I'm not sure if I'm saying this right, desensitization, like because if we have watch porn and masturbate too much and all that, and by the time we actually have sex, we are not turned on, we're not aroused. Can that happen too, right?
Actually, that thing is actually a myth. Actually, it's still back to the basic of the psychogenic component. If you feel that you want to perform just like the one in the movie or in the pornography, you will definitely have this issue. And then you did mention just now about masturbation, right? Okay, so masturbation is actually, if as a urologist, Kevin, masturbation is actually a good channel to release sexual tension. Because you have so much of sexual tension built up, masturbation can sort of like relieve sexual tension. But of course, masturbation have to be done in a correct way. In a correct way. If not, like you said just now, it will cause erectile dysfunction and it will cause premature ejaculation, especially when you masturbate in a hurry, when you practice dry masturbation. So when you got married, when you have your partner, so it will be a problem because now you have real vagina, wet vagina, so that will be an issue. So if you do it,
what do you mean by correct way? Could you just elaborate a little bit?
Yeah, a lot of people, if you don't mind me discussing a bit about this, masturbation need to be done in a correct way, meaning that you have to give time to masturbate. You have to enjoy masturbation. You cannot do it in a hurry, because if you do it in a hurry, you are practicing, actually teaching yourself to hurry, meaning that it will lead to premature ejaculation because you will ejaculate in a very short time. And then of course the other thing is that if you want to do masturbation, you have to do it with the correct medium, meaning that you don't do it like dry masturbation, meaning that you do it with a pillow, you do it with a blanket. So you have to do it with the correct lubricant. You have to do it with the correct water-based lubricant. Some people will do it with soap and all that, will lead to a lot of problems that I've seen in the hospital. So when do you practice dry masturbation? When you have sex with a woman which is wet, then it will trigger premature ejaculation. Because you see or not the difference between dry and wet. So these are the one of the reason why if you want to masturbate, you have to do it correctly. You cannot just do it in the toilet very fast and then try to ejaculate as fast as you can. So these are the things.
This is great, Prof. I don't think so many men actually thought about there's a correct way to do it, right? We just watch TV, watch porn, whatever, and get our information from there. This is really good information. Thank you so much.
That's right. My pleasure.
Now let's dive into treatment options. The most popular, of course, most of us know is the blue pill. Well, does that really work?
Okay, right. Of course. Kevin, when we're talking about treatment of ED, there are actually three categories or three steps. The first step, the most basic one, is of course what we call the pills or what we call the drug is actually, we call it phosphodiesterase inhibitor, PDE5 inhibitor. So of course the blue pill or what we call Viagra is belong to that group. So and nowadays there is a lot of other pills that is available. For example, if I can quote here, Cialis, Levitra, even the generic one, for example, like Ignite. So they belong to this category, what we call PDE5 inhibitor, or basically it's a vasodilator, meaning that it will boost the blood flow into the penis. So of course, when a man with erectile dysfunction comes and see us in the clinic or in a hospital, this is the first tier that we give to the patient. Of course, the second tier will be injection, pumps and all that. And then of course, the third tier will be the surgery, so the surgical management. But of course, the most basic one is the pill. So whenever they come to the clinic, of course, during the first consultation and all that, yes, they would expect for us to give pills. But we have also need to find out what is actually the cause of erectile dysfunction. Like I mentioned to you just now in the beginning, psychogenic ED is also one of the issue, and psychogenic ED can be helped by the pill, but we need to find out what is actually the psychogenic process. But when I'm talking about organic ED, yes, the pill is the first thing that we give to patient.
Is it good to remember that it's not a permanent fix, it's just temporary, and we need to find out what's maybe stress levels and all that are causing it as well?
Yes, that's why I did mention to you, when a man have ED, right, especially due to organic causes, these ED are not curable now, Kevin. So meaning that once they develop ED, for example, secondary to diabetic, right? Of course, when you control the blood sugar, the ED will still be there. The ED is not going to be reversible. So the pill is helping them to achieve a good erection, but the pill is not going to cure the ED. ED is something that is irreversible, except in the condition where it is a psychogenic ED. So people have to remember that pill is actually good for erectile dysfunction, but the success rate depends on so many factors.
And what about the side effects?
Okay, normally PDE5 inhibitor, because as I mentioned to you just now, it's a vasodilator. The side effect, the common side effect is sometimes, facial flushing, because the blood vessel on the face also got dilated. And then sometimes they have headache. Sometimes they have sort of like epigastric pain, stomach discomfort. But all these side effects are very low. It's actually less than 5%, and most of them are tolerable. So most of the patients are able to sort of like, okay, go through with it. If you have headache later on, maybe you can take Panadol and all that. So we are not worried so much about the side effect, because as I mentioned to you, it is less than 5%. So those are the common side effects. But we have to be careful. We cannot prescribe PDE5 inhibitor in patients with heart disease. So that's why, as you know, this kind of medication, you just cannot go and buy over the counter, Kevin, because if they take some sort of medication together with these pills, they will have very low blood pressure. So we have to be careful in that. So that's why all this need to be prescribed by the doctor, because we have to assess them first.
Now, that's why we have these discussions, because many men might just get the pills without a doctor's prescription. And if you don't know about your underlying medical condition, you can be doing more harm to yourself. So man up, see your urologist or your doctor first before swallowing any pills or taking other treatment options, all right? Now, there are other treatment options besides pills like shock wave therapy and injections. So let's ask the doctor, how does this work? In Malaysia, how popular are the other treatment options like the shock wave therapy and injections? Are those popular in Malaysia?
Yes. Okay. As I mentioned to you, ESWT. There is the shock wave. We call it ESWT. Is one of the options. Studies have been done to show that ESWT is one of the options when you have erectile dysfunction, but normally it needs to be supplemented by pill as well, because the shock wave needs series of treatment. It's not like you do just once and then you expect that the next day you are able to perform. It needs series of treatment, because the basic concept of the shock wave is that they try to break the narrowing of the vessel and promote new vessel growth. So as you know, it will take time. So most of these people who are undergoing ESWT also need pills. When you're talking about injection or injectable, these are the second tier, meaning that injectable or injection are given for those who fail the medical or the oral treatment. or the one that is contraindicated to take oral treatment. For example, people with a weak heart, people with taking some sort of heart medication that we cannot give the pill. So injection is quite good because injection, it acts locally, meaning that when you inject, you will expect an immediate erection. So some people like it. For those who have severe diabetic and all that, right? We prefer to give them injection. So injection are quite safe, but it need to be prescribed by a doctor. You just cannot go injection. You know, people now give injection everywhere. So you have to get a good injection.
But you have to do it yourself, right? You inject yourself,
yes,
right?
we teach them, and then we need to give them the correct dosing. So that's why they need to come to our clinic. We need to discuss. We need to give them what we call a test dose to see which dose are suitable for them. There are a lot of dosage. Yeah.
And how long does it take for it to work, the injection?
Okay. Normally, we'll say about 5 to 10 minutes. 5 to 10 minutes for the erection to get a good erection, and then it will take about 15 to 30 minutes to go down. So some people like it because even though after they ejaculate, they can still have the erection.
Yeah.
So that's the sort of like the beauty of the injection, But we cannot give to everybody, Yeah.
Oh.
So that's the issue.
Now let's talk about some other new or popular treatment suggestions. Firstly, there's a new gel that's on its way to treat erectile dysfunction, and its research have shown that a man can get a stiffy in about 10 minutes. Although it's still going through the approval stage, I asked Dr. Zulkifli what he thinks about Med 3000.
Yes, Med 3000 is actually really, really new. It has not arrived in our show. In fact, FDA also needs some sort of approval. So I think next year there will be some. They're waiting for a lot of trials because these are at this moment. I think Med 3 is in their phase 3 trial. We need a lot more data to convince people that it works. So of course, Med 3000 gel is actually some sort of a local therapy, just like an injection. So when local therapy, it bypass the oral and all that. So of course, it is expected to work faster. Because as you know, PDE5 inhibitor takes about 30 minutes to 1 hour. It depends on the patient, right? But this one will work a bit faster because it's more like a local therapy. So when you achieve a local therapy, you achieve a local vasodilation, it will definitely be faster as compared to pill. Yeah. Right. But Med 3000 is actually, the journey is actually quite long to reach our shore. So I think in the quarter of 2022.
Wow.
So we have to be careful about the fake ones. So I'm just a bit worried that people start selling Med 3000 already. So we have to be careful of that.
So while we wait for Med 3000 to reach our shores, get the right treatment for erectile dysfunction by speaking to your doctor. All right. But there are some men who would try to fix their ED problems themselves with things like Tonka Ali. Well, does Tonka Ali really work?
Okay. Tonka Ali and other things that they claim to cure erectile dysfunction. Actually, Tonka Ali is actually herbs, right? It's actually herbs that is found in Southeast Asia. And Tonka Ali is actually what we label as a supplement, Kevin. It's not a treatment, but it's a supplement. So for me, as a urologist, okay, you can take Tonka Ali, no issue. But if you have erectile dysfunction, you don't treat Tonka Ali as your treatment for erectile dysfunction. You can take it as your, for well-being and all that. Even though the data, there's a lot of data to show that it is actually not really to secure the erectile dysfunction, but it helps erectile dysfunction in some of the papers. But it is not the treatment for erectile dysfunction. If you have erectile dysfunction, you cannot say that, I will take Tonka Ali kopi or I will take Tonka Ali serbuk to cure my ED. Cannot. It's actually for your supplementary health. Yes, you can take it.
It's something like ginseng. Is it
Something like that,
Mm,
something like for women, you say like kacing
mm,
Fatimah and all that, So
mm.
it belongs to the same category. We cannot label it as the treatment for erectile dysfunction. No, it should not be labeled that way.
Okay.
But you have to be careful. You look at the content of the coffee that contain Tonka Ali, like how much sugar is inside there. You have to read the content.
Yeah.
So you have to be careful in all this.
Okay, Prof, let me just turn it around because you said it's a supplement, right? And now that we know that 7 out of 10 men in Malaysia gets ED, and if I want to sort of prevent myself from getting ED, then should I be taking Tonkat Ali not as a treatment, but just to help prevent erectile dysfunction?
No, you cannot. You cannot. There's no such thing as preventing. Preventing ED is preventing you from getting like diabetic hypertension and all that. You have to start very early promoting healthy lifestyle, exercise and all that. So there's you can't really take this to prevent. Just like people are talking like taking sour tomato to prevent prostate growth. No, you cannot prevent prostate growth. As long as you have testosterone running in your body, you cannot prevent prostate from growing. So my message is that you can take it as a supplement, like you take vitamin C and things like that. But if you have that problem, you have to come to the right people to consult about it. So that's the thing.
Now, if you're Malaysian, you probably heard of the term Urut Batin. What actually is Urut Batin? Okay, I'll throw in one more. Urut Batin. Yeah. What is that?
Okay. I'm not against Urut Batin, but Urut Batin also is not the treatment for erectile dysfunction. Urut Batin, if I can reword it, it's like somebody is, you ask somebody to masturbate you. I'm so sorry to say this, but that is the real thing. Because if you look at the problem of erectile dysfunction, it is a vasculogenic problem. By massaging the penis, you are not going to dislodge whatever that is obstructing your blood vessel, right? People are claiming that they can do that. But if you study the anatomy of the penis and all that, definitely Urut Batin is not the treatment. If you want to go for Urut Batin, go ahead, no problem. But if you have erectile dysfunction, you cannot go for Urut Batin expecting to cure your ED.
So it's just a massage lah.
It's just a massage. It's just like a massage. But you have to be careful because I've seen people who develop complications secondary to Urut Batin. For example, like the pinna become bruises, hematoma, even though a condition what we call a fractured penis because of aggressive Urut Batin.
Wow.
So they have to be careful. You have to be careful. I'm not stopping, but you really have to relook into all this kind of thing. Because on the other end, we are in the hospital, we can see this kind of problem coming to emergency department.
Yeah. Wow. Prof, really great advice there. I think some things that men don't really consider, and always we want the fast solution, right? As men, we always want solutions and we want it fast. But
that's right.
A lot of things to look into.
There's no fast solution to everything, especially men's health. Kevin.
Well, I hope that gives you some clarity on Urut Batin and also some caution that things can go horribly wrong, as Dr. Zulkifli has seen in the emergency room. So to end our conversation on erectile dysfunction and treatment options, I want to talk about this new men's health platform in Malaysia. It's called ensans.com.my. And Professor Dato Dr. Zulkifli is one of the medical advisors for this platform. So Doc, tell us about ensans.com.my.
As we discussed before the beginning of the show, Ensans is actually a platform. My role is actually an advisor to Ensan, and I'm honored to be an advisor because Ensan is a platform where we normally, put a lot of article, put a lot of information about men's health. If you want to sort of like discuss about men's health, if you want to find out about men's health, Ensan is one of the group platform. Even we have Ensan has sort of like online consultation. where, you know, if you don't feel like going to the GP, you don't feel like talking face to face to the doctor, you can sort of like, you know, use Ensan as one of your platform. So you can voice out whatever the problem, and the doctors, you know, these are the trained doctors, will get back to you. And even sometimes they have this kind of, you know, online platform where they can sell the PDE5 inhibitor and all that to you, of course, after the consultation.
Mm-hmm. Yeah.
So, one of the good platform, because as we know, for men, not many platform that we can discuss about this, can Kevin? So that's why.
And even for men, coming to see a doctor face to face can be a bit embarrassing, and you know, they don't want to talk about it. This is all done online, right?
Definitely. These are done online, and you can get all the articles and all that related to your problem online. So you can read about it, you know. And these articles are contributed by the professionals, you know. And as you know, not only sexual health, and sons also have their mental health platform. So which is also very important for men, mental health. Yeah.
Great. I think it's great. It's sort of like a support platform for men. You know, finally we have a place we can go to, and like you said, the articles, information by real doctors, not bloggers, real doctors, right?
Because sometimes when we Google, there's tons and tons of information, but I don't know whether it's correct or not. You know, so we have to be really selective. Yeah.
All right, Prof, thank you so much for coming on the show.
Thank you very much for inviting me, Kevin. It's really, really my pleasure to share this with you.
So that's our episode for erectile dysfunction treatment options. A big thank you once again to my guest, Professor Dato Dr. Zulkifli Zainuddin. If you'd like to stay informed on men's health issues, do like this video, share it, and of course, please do subscribe. We have more topics on men's health specifically to come on this channel, and I'm sure all the information will be very beneficial for you. So please do subscribe. This also motivates me to keep on doing videos like this, and I hope Man Up Malaysia can be a channel for us men, for us bros, to learn more about men's health and man up to take better care of our health. I'll see you in the next episode.